I've been pushed, I've been scratched, I've had things thrown at me, I've even been bitten, I've even been strangled. It took 2 large male nurses and a security officer to get the man off of me.
There's a lot of punches that are thrown that don't necessarily connect. There's weapons, there's threats, lots of things that no one ever reports because they think if they didn't get hurt, it's not something you report, it's not something you talk about, it's just part of the job.
Healthcare workers in hospitals, clinics, and other healthcare settings encounter violent acts like those just described each and every day. Reporting acts of violence is typically voluntary, and therefore incidents are grossly underreported. Healthcare workplace violence comes at a high cost, including physical injuries, psychological trauma, fear of returning to the workplace, negative impact on relationships, feelings of doubt, incompetence, and guilt. But if your healthcare organization is equipped with the proper strategies and tools, violence can be mitigated. Omnigo's Healthcare Workplace Violence Prevention video-based training series is designed to specifically address the challenges of violence in today's healthcare settings. Healthcare workers from medical assistants to physicians and admins to executives will benefit from the practical knowledge provided in this detailed training series. Participants will become familiar with the broad consequences and costs of healthcare workplace violence. Recognize the 4 most common types of violence in healthcare settings. Understand the difference between incivility and bullying. Learn to implement effective techniques for de-escalating potentially violent situations. Gain the knowledge required to properly respond after a violent incident occurs. Learn how to perform personal and work environment risk assessments while learning tips for managing stress and anxiety. All members of a healthcare organization, from entry-level employees to the highest level of management, can help mitigate violence and create a safe workplace for healthcare workers and the patients they serve. Are you ready to get started? Contact us to learn more.